subject of my presentation is magnetic and plasmonic nanoparticles for space theranostics. I'm a PhD candidate at AGH University of Krakow, and together with my supervisors and with Gabriela, who finished her PhD last year, we study such magnetic and plasmonic nanoparticles with various coatings. And I would like to introduce the benefits of theranostic approach for space medicine. I will cover some basic principles of theranostic approach, and I will present some of our results of research on nanoparticles. And this may be an appropriate moment to explain the meaning of the term theranostics, as not everyone may be familiar with it. And theranostics, just as the name suggests, is a combination of therapeutics and diagnostics. There are two ways in which this is written, with G or without, but both are in use. And it is basically a simultaneous or sequential diagnosis and treatment of medical conditions. And nanomedicine is especially useful in realizing theranostic approach. And for example, how can it be carried out? Let's say we have a patient, and this patient, for example, has a tumor. So we could use magnetic nanocapsules with a contrast agent, and this contrast agent is the diagnostic part, because it allows us to perform imaging, like magnetic resonance imaging. And also such nanocapsules can contain anti-tumor drug. So when we know that the capsules are inside the tumor, there could be some controlled release of such drug to target only the affected tissue. Of course, this example sounds more relevant to terrestrial medicine due to the length of space missions. However, there can be many other conditions that could also require targeted healing, because, for example, targeted drug carrying makes sure that the drug delivery is more efficient, because the drug is not wasted on going in the organs in which it is not needed. It goes where it needs to go. And moreover, it is possible to precisely measure the dose that is delivered. And the differences between terrestrial medicine and space medicine are the reason that makes theranostic especially well suited for treatments also in space. And why is that? In terrestrial medicine, it is possible to change with the treatment centers to call other doctors, nurses, while in space medicine, the resources are quite limited, the workforce is limited. So when it's possible to combine therapy and diagnostics, to combine anything, it is more effective, more efficient, and also safer. Also, there are factors that call for some changes in approach, such as microgravity and radiation, because they can have impact on how efficient treatments are. And space conditions in general pose various challenges for the medicine. Some of them can be mediated also thanks to theranostics. Some of them may be not as well. For example, when we have microgravity, people are more prone to muscle atrophy, to bone mass loss, and supplementation of minerals could also be performed with targeted carriers. But there are less obvious conditions that are possible, like the regulation of the circadian rhythm, that can cause various health issues and therefore cause some compromised immune system, along with the other factors that also contribute to such a condition, like compromised immune system. And whenever this happens, mediation of the spread of diseases is necessary, and then fast diagnostics and fast treatment is required. And when we have medicine in space, the stability of those medicines, of those drugs, can be impacted by radiation, by vibrations, by microgravity. And when its stability is affected, the efficiency of therapy also can be changed. Absorption can be changed, distribution, as well as metabolism and elimination of medicines. So how does nanotechnology help? Apart from the first example. In general, novel, more efficient means of drug delivery. Other examples that would be possible include defense from radiation through timed release of some radioprotective pharmacological agents, which is called the nanoglands technology. Other possibilities would include protection of neurons of the retina with serum oxide nanoparticles, thanks to their regenerative properties, and also protection of the nervous system. Moreover, nanotechnology, more precisely quantum dots, enable diagnosis. They can serve as markers. Something that I will focus on are iron oxide nanoparticles and gold nanoparticles in drug delivery and imaging. And what we must have in mind is that it is very, very expensive to bring cargo to space, and saving weight is saving money. And when it's possible to perform some operations in space or some diagnostics and therapy, it is better to make it possible. And if it's cheaper, it's more possible. Of course, at the moment, we just considered it in the context of, for example, space stations like International Space Station, rockets. But in further perspective, it would be nice to also think of what maybe habitats, maybe lunar or Martian habitats, would be available to have available in there. Okay, so now let's go on to the specific types of nanoparticles. And magnetic nanoparticles are typically made of iron oxide. That could be magnetite, that could be machemite. The property that makes them so interesting is, of course, the fact that they react to magnetic field. And their properties are different depending mainly, for example, depending on their size. And when it comes to plasmonic nanoparticles, they are typically made of gold, but other noble metals are also possible, like silver. Their properties that make them usable in this context is the fact that they exhibit so-called localized surface plasmon resonance, abbreviated as LSPR, which means that they interact with specific wavelengths. And for example, when they are hit by that specific wavelength, they heat up. And the wavelength with which they interact in this way depends on their size and shape. Moreover, gold nanoparticles are thought to be quite biocompatible, which is also extremely important. And there are some so-called green synthesis techniques of such nanoparticles that don't utilize harmful substances, that utilize non-toxic substances. And both of those kinds of nanoparticles can be functionalized with various coatings, and sometimes even with some antibodies, ligands, that make the targeting even more effective. Magnetic nanoparticles are already used as MRI contrast agents for magnetic resonance imaging to enhance contrast. They're also considered as drug carriers for the navigation with magnetic field, and also magnetic hyperthermia can be induced using those nanoparticles. And plasmonic nanoparticles can be used in biosensors for plasmonic hyperthermia. for radio frequency electric field hyperthermia, and are also candidates for drug delivery or medical imaging. And when we are at the topic of plasmonic nanoparticles, biosensing and lab-on-a-chip solutions can also include gold nanoparticles in order to enhance the signal at the readout. And also they are sometimes just use the biosensors for the identification. And lab-on-a-chip solutions also allow to combine functions that would otherwise require a whole laboratory with lab technicians, etc., to, for example, identify whether there is some contagious disease, virus, some other pathogens. And it's another kind of solutions suitable for space applications because of their very small size and the fact that they allow for rapid screening. So rapid screening could also help prevent the spread of contagious diseases. And now a couple of words more about targeted drug delivery. This idea is based on the magic bullet concept that was already introduced in 1909. And this idea involves a drug and a pharmacologically inert carrier. And the idea is that while some drug is beneficial when it's in the organ that is affected by the disease, such a pharmacological agent could possibly be not so beneficial for other tissues. So we want to protect those healthy tissues. And the way to do that is to enclose such a drug in that carrier and to deliver the active substance without damaging that healthy tissue, so that to maximize the therapeutic outcome while minimizing harmful side effects. And here we have a diagram of how such a nanocapsule could be made. So we could have those magnetic nanoparticles that enable magnetic navigation, this active substance, so some kind of medicine, some kind of drug. Then we have the capsule itself, and we could also have some biomolecules, some antibodies, but not necessarily. And how do we study such nanoparticles when we already have them, when we want to make sure that their properties are desirable? As I mentioned before, the size of such nanoparticles is important, both in the context of those magnetic ones and those plasmonic ones, because their properties depend, among others, on their size. So even before we perform imaging of the nanoparticles, we can perform X-ray diffraction study, and we can calculate the size of the nanoparticles. And here we have comparison of a couple of types of magnetic nanoparticles with a diffractogram of microcrystalline magnetite. And we can see that nanocrystallinity causes line broadening. We can also see those lines there and how they are a bit, the ones of the nanoparticles are a bit shifted to the right in comparison with the lines of the microcrystalline magnetite, which reveals that the lattice constants are a bit larger. So this means that we have maghemite actually in those nanoparticles in comparison with magnetite. And measuring the width of those lines enables us to calculate the size of those nanoparticles. And the size decides whether we have actually superparamagnetic nanoparticles. Superparamagnetism is a property of nanoparticles when they are when a nanoparticle is a single magnetic domain, and the magnetic moments can flip randomly in such a single magnetic domain. And we can see, for example, that among those samples, there are nanoparticles that have a diameter of 7 nanometers. So this is the smallest sample. And later we'll look at a bit at the magnetic properties of such nanoparticles. And another sample which is a bit larger. Here we have a hysteresis, a magnetization of that a bit larger sample, and we can see in which temperature it is superparamagnetic. We can see the superparamagnetic blocking temperature, to be more exact, and we want to know in which temperature the material will exhibit superparamagnetic properties. For example, if it is the room temperature that is good for the patients to be in. And for example, for this material, this superparamagnetic blocking temperature is quite high. But for comparison, for that smaller sample with smaller diameter sizes, the superparamagnetic blocking temperature is quite lower. And I don't think we have much time, but for comparison, we have a diffractogram of plasmonic nanoparticles, gold nanoparticles, also a couple of different samples. And for them, we can also calculate their sizes from such diffractograms. And of course, perform some imaging to see how such plasmonic gold nanorods look. And to sum up, nanoparticles can be helpful in diagnostics and in therapeutics. They're especially useful for extreme environments, such as space, but for example, also Arctic regions that are kind of isolated on Earth in any extreme conditions where it would be not possible to perform quick transport, for example, of a patient to a whole hospital. And theranostics is a promising approach that allows for less invasive methods of healing. And less invasive methods are generally safer and therefore more effective. And thank you very much for your attention.